Many of us, particularly early in our careers, tend to focus too much on the psychedelic experience that the person is going through as a means of resolving the symptoms of trauma. But what I would say is think of it as a rule of thirds. Think of the actual psychedelic journey as just a third of the entire experience and put that first third in preparation. To me, preparation is so vital in such situations that without adequate preparation, it would almost be unwise to go through a psychedelic experience. And in preparation, it isn't at all that you, dear patient, will unfold your trauma the way I'm telling you you should. You should do it step at a time. It should not be too disruptive. It should be clean and neat. No, none of that. But this real creation of trust. I will repeatedly use the word trust in this process because most individuals who've gone through trauma have really created walls of mistrust around them. And that extends to therapists. And that's why great humility on part of the clinician saying, I will never fully understand what trauma felt like to you. But what you can do, dear patient, dear client, is you can trust me to be with you, to keep your body safe and your mind safe as you go through that journey. That is crucial. And then, of course, during the experience, a complete openness, which requires great strength on part of the clinician, a complete openness to whatever comes up, and not to be judgmental, but to be available, to bear witness to whatever is happening, and not to be so affected by it that it colors or frightens you. Mm-hmm. And then, of course, the other third is integration. And this rule of thirds really needs to be followed rigidly. Otherwise, what ends up happening is the middle third, the actual psychedelic experience, sucks up all the oxygen in the room. It becomes the whole activity. Mm-hmm. But in reality, it's only a third of what really needs to happen with patients. Yes. And I think we need to emphasize the following. Experiences mean nothing unless there's meaning derived from those experiences. Mm-hmm. There's no value in being shot to the moon by the psychedelic and watching nothing but love infuse the entire world. There's no value in it because that experience will be gone in 2 hours or 10 hours unless A, it's remembered, B, there's meaning derived from that experience, and C, very importantly, appropriate action steps inserted into the person's life by the person themselves. Otherwise, it's nothing but just an experience of really very little value. So it is that triad. It is the appropriate preparation. It is the actual experience. That experience often is a necessity. I'm not trying to minimize the value of experience. I think it's crucial. It is the catalyst. It's the catalyst to a reaction that wasn't happening for 30, 40, 50 years in a person's life. So it's really important. But it's not so important that it takes the place of the other thirds.